My name's Mary, and
My name is Elise.
My name is Stephen.
Yeah, my name is Jason.
My name is Audrey Shaw.
So I'm Katie Flannery.
My name is Dr. Susanna Storing.
I survived a rare form of brain cancer 2 times.
And I have cystic fibrosis.
And I have a 10-year-old daughter with a rare 1p36 chromosome mutation, which is also known as radio tartaglia.
Former U.S. Marine, disabled veteran, and below the knee amputee on the left side.
I was starting to have trouble with my left foot and my left fingers. So we thought possibly I was having a stroke. So I went to urgent care and they took a CAT scan and they discovered a brain tumor. And I went to Henry Ford and they have a neurology center there. I was admitted to one of their doctors and I had surgery performed. They took the tumor out and told me I had central nervous system lymphoma. So after that, they assigned me to a cancer doctor. I proceeded to have chemotherapy treatment for quite a while. I was responding well to the chemotherapy treatment, and my health was still pretty good. So they felt I was a good candidate for a stem cell transplant. But because this was during COVID, I didn't feel like I was emotionally prepared to handle something like that. The other alternative was to continue the chemotherapy treatment at the hospital every 3 weeks for a while. So I continued to do that. And finally, I was in remission. I got to take a break from the chemo. I was pretty much back to normal, bike riding, going for walks, doing lots of fun things with family. And then a couple months down the line, the cancer came back. I was very devastated, and I figured that I was not going to make it this time. So once again, they offered me the stem cell transplant, and I was doing fairly well. So with the support of my family and friends, I decided to go ahead and have the stem cell transplant. And it worked. It was 2 years ago, and so far I continue to do well.
So when I was around 11 or 12 years old, I started having sinus symptoms. I couldn't breathe through my nose, and I had illness symptoms for a very long time. And so I started the process by going to see if I had any severe allergies, and that was a no. And then it went to asthma, and it went through a whole long path of eventually getting diagnosed with cystic fibrosis. That happened when I was 13, and I have been receiving treatment for cystic fibrosis ever since then. The most difficult part for me was definitely doing the daily treatments, especially a few years back before Trikafta had come out. When I started this whole treatment process, I was doing purely physical and inhaled treatments. So I had inhaled nebulizers and then a vest to kind of dislodge mucus. And it was really hard to do those 3 times a day, which is what I was expected to do, especially even harder as I moved out on my own. I just struggled with that. And now I take medicine, Trikafta, which for me has meant that I don't have to do those treatments 3 times a day. I was relieved.
It took probably about 6 or 7 years total to get the actual diagnosis. It was a long process. It started when she was 18 months. Her pediatrician said that she thought she had some kind of syndrome, so she kind of started us on our journey. She recommended getting genetic testing. She recommended some specialists. So we started going through a bunch of different doctors and teams to try to figure out what was going on. We got on some waiting lists for autism diagnosis, and it was just a really, really long process. And the hardest part was just the not knowing. And when we did genetic testing at first, we went through 3 rounds of that. And each one, it took a long time to do the testing, and then it took a long time for the results. We had to wait each time. And then after all 3 rounds were done, and that was basically every genetic test they had at the time, everything came back fine. So there was no diagnosis, there was nothing at all. So I guess the biggest challenge was just the amount of time spent trying to get the answers. As we finally did, they introduced some new genetic testing a couple of years ago, and they reached out to us, and that's how we got the final diagnosis of what she actually has.
I got injured a lot in the Marine Corps on several different parts of my body. My left leg took a lot of damage, a lot of ACL reconstructions. I tore my meniscus or messed it up when I was deployed. And that was kind of like where everything started, because it was meniscus, but then they didn't see that there was an ACL tear as well. I just had a little plastic brace that I put on to finish the rest of the deployment, and it just kept getting worse and worse. So fast forward like a year, they sent me to Wounded Warrior Battalion. They try and get my leg to where the muscles are still working, but everything just kept screwing up. Like, it wasn't, the muscles weren't growing. It looked weird. Medically, I get out of the Marine Corps, send me to the VA here in Ann Arbor, and they're like, well, look, we're going to try and save this thing as best we can. So they sent me to this place, Grand Blanc Family Foot Care. There, the doctor said, all right, well, look, your toenails they just weren't growing. And so he took my big toenail off first. And then, like, after that healed, he's like, oh, okay, we got to take the rest of the toenails off. Then I think that's going to be fine. You'll be able to keep your leg. So that didn't work. So then I go to Flint Foot and Ankle. They do the transmetatarsal amputation of my foot, because they're like, we think this is going to take care of the problem. That didn't take care of it. They send me to Ortho, Michigan, and the guy looks at my leg and he's like, this is an amputation waiting to happen. About a month and a half went by and I didn't hear anything. And then beginning of November, I want to say 22, I think, they called and they were like, hey, we have an opening. Would you like to take it? It's in 2 weeks. And they're telling me, this is how we're going to do the amputation. This is what we would do. We would give you this socket for this. So I'm like, yeah, let's do it. So that's basically what led to it. So they gave me the transcipital, and everything is like working perfectly fine now. So I don't know if they cut off whatever was wrong.
I had positive experience with the medical staff, not just the doctors and the nurses, but the radiologists, the lab people. And I had been at 2 different hospitals. So everybody that I came into contact with was kind and empathetic and very knowledgeable. My original cancer doctor, she was extremely knowledgeable. She was also very patient with me. I had a lot of anxiety throughout this whole process, and she was very, very encouraging. And she also was so helpful to my family members who had many, many questions throughout this whole process. I felt that they were treating me as a whole person, and I never felt overlooked. The people that I came in contact with were very empathetic. Anytime I had questions, they took their time to answer. I never felt like they were rushing, even when they did the rounds at the hospital. When I had a lot of questions, they took their time with that. There were a couple of nurse practitioners that were amazing. They spent a lot of time with me, sitting at my bedside, helping me just to process my decision making. And they didn't tell me what to do, but they were encouraging me to do what I felt was right for me and not to feel pressured by my family or anybody else. So they were wonderful. The stem cell process was very, very difficult for me. You had to get a 3-prong catheter attached to your vein in your heart. And I was scared to death of that. But again, the nurses and doctors talked me through it. So again, the doctors and nurses were very empathetic, helping me through the process to understand it. And they were right on top of any side effects I had during that time.
And my CF care team has been great. I really enjoyed them. They're down at the Children's Hospital in Detroit, and they have taken care of this very well. Leading up to that, there was a lot going on because no one knew what was happening. Every medical provider was trying to be the one to figure it out, and a lot of repeating the exact same story 10 times over to a new doctor, nurse. And that part felt very impersonal because it was just trying to get to the diagnosis, whereas my CF care team has a very personal relationship with them. My CF care team at the Children's Hospital has been great. One thing that they did recently that I really appreciated was allowing me to stay in the CF Children's department until I graduate college, because they just understood that I was already going through a lot of stress and just had a lot of responsibilities as I was going to college, and they didn't force me out of the children's wing the moment I turned 21, which I very much appreciate, and they are going to let me stay there until I graduate my undergraduate degree. Nowadays, I feel prepared for appointments. I know what's going on, and my health status hasn't changed in a very long time, which is a good thing. Before that, I never really liked going to the doctors. It just felt like I was being poked and prodded at too much every single time I went. Before I had my nasal surgery, I was definitely very nervous. I would say that's probably one of the most nervous times I've been, was going in for that surgery. But once that was over, things got a lot better. And I felt a little more prepared for all my future doctor's appointments, because I had the major thing that led to this diagnosis taken care of. I really like my care team. In particular, my social worker is great. She's definitely in the right role. She asks me about my life outside of it all the time, college, all the classes I'm taking, which I love. And I do love sharing my life with them when they ask. And that makes me feel more than just cystic fibrosis and as a whole person. And they do a very good job at that. Communication has had a really big role in my treatment, especially over email and things like that. When I go in for a test at the CF center, I'm not usually back in person at the center for another 3 to 6 months. So they will always keep in contact over email so that I'm aware of my health before going back in 3, 4, 6 months later, which is very important because it's keeping me so I'm not just being hidden in the dark with my own health. Empathy and kindness also have a huge role. And like I've already said, my CF care team is great. I feel like they really do care about me as a person. They've done so many things that make me think that, just asking me about my life outside of CF. They're very understanding of the fact that, especially with Trikafta medication, I don't have to do my treatments frequently. I usually do them when I get sick, and they understand that. And because I am healthy, that's not their main point of concern, because I am healthy and doing what I need to do to keep myself healthy, which I feel is very important, because that is one of the biggest things I dealt with before getting to this team, was just, if I'm not doing my treatments in the exact way I'm supposed to be doing them, then that's the only concern. There's nothing else I can have going on in my life. And that is the thing I need to focus on. And they have not made me feel that way. I see about 5 or 6 people, I would say, when I go in to a doctor's appointment. And I feel like I'm always the one who talks last. Like, they never leave before I'm done talking about any concerns, or even anything that they ask me about, a non-medical related question. They don't leave until I'm done talking about my class that I enjoyed or whatever it may be. So I definitely feel like I have a good amount of time with my care team.
You could tell they cared. They cared about us. They cared about her. They took a lot of time with us. So they were really nice just to sit with us for as long as it needed. Only downside was we had to wait a long time to see them too. But it was nice to have them spend the time with us. Her pediatrician, who we met before our first daughter was born, and she just seemed really caring right off the bat. She asked a lot of questions, asked about how we were doing, like what some of our parenting styles were. You could tell she wanted to be really involved and help us along the way. The challenge was that every time we'd ask a question, there wasn't really an answer for it. And it wasn't the doctor's fault, of course, but that was more frustrating on our end, just not being able to get to the bottom of it or find out what's going on so we can actually treat it. I feel like overall, most of the doctors we saw were really helpful and seemed to understand the challenges we were having and what we were trying to do. Most of them were supportive, sometimes confusing too. One of the things we did first, when it was probably when she was maybe 3 years old, we got on the waiting list to go to U of M for their autism center, and it took a long time to get in. But when we finally got in there, they worked with her for a little while, talked with her, then talked with us, and they came back and said, there's definitely not autism. There's nothing that shows that. She's too social. Her eye contact's good. That kind of set us back, I feel like, because had we had that diagnosis earlier for autism, we could have gotten a lot more treatment for her when she was younger, but then we still found a way to get some help for her and see some other specialists and doctors. A lot of times they would just sit and talk with us after seeing Sophia or after some of the tests. And I could tell, they wanted to figure it out too, especially our pediatrician. I remember she would always ask for updates when we went in to see her, and she'd recommend other specialists to see. So I think it was a really humanistic approach, which was helpful for us. with the challenges that we were facing and just not knowing what it was that she had, like what was causing some of the developmental delays and some of the behaviors she was having. So it was really helpful to have empathetic doctors and caregivers that would help us along the way. You know ahead of time you're going into like a 4 or 5 hour appointment, but it was just nice knowing that they weren't going to rush us out of there, that they were going to talk to us, answer our questions, and try to help us as best they can.
So with the VA doing my amputation, interacting with everyone there has been amazing, from start to finish. The experience was amazing. The recovery has been amazing. They're actually, I won a grant to have them come, and they're basically going to make this house like ADA compliant for me, but I get to pick the stuff for it. So they're doing all these kind of things for me. So yeah, the treatment, the recovery, everything. People have been great, and that's my experience. Maybe other people have different experiences and stuff, but yeah, mine was and still is good. Dr. McNeil, he's my primary care physician, and never in my career in the Marine Corps, dealing with all the medical providers and everything, I never, ever felt like the way he's like, he will remember everything. I'll walk in there, hey, how's your dogs? How's it? But he's like, he's calling them by name, asking about the girls and stuff like that. And every single time I see him, he's like, I was thinking about the leg, and what about this? And how has your back, like since you've had the leg this way? And so it's been awesome with him. I feel like he's been in my corner for literally everything. So it's been amazing. I felt supported by everybody, like everyone was there for me and everything. It's good that it happened. Finally, it happened, because it improved quality of life like crazy. I never felt overlooked ever. I felt like I was definitely treated as a whole person. Communication was great. That was great. I knew it was going to happen. Things felt rushed at times. Like, hey, you want to get your leg cut off in 2 weeks? Like something like that. That kind of got rushed a little bit. But I knew every single solitary thing that was, that was going to happen.
I would define good care as from someone who is extremely knowledgeable about the field, first of all, someone who listens to you and addresses your concerns and takes their time to spend with you.
Good care is definitely viewing someone as a whole person with their own life, rather than just looking at whatever medical problem or diagnosis they are dealing with at the time. I think it's really easy to just only focus on that because that's the medical side of things, but it makes it harder to, I guess, integrate that medical side of things with the rest of your life when they're being separated in a medical setting. So someone who can really look at your life as a whole is a good provider.
I would define good care as a combination between knowing the technical medical aspects of it and knowing how to talk to people too. I know some doctors that are like really, really smart, but they don't have the people skills. And I would rather see a doctor that's not quite as smart, but still knows what they're doing, of course, but has the people skills to know how to talk to someone, and that shows the empathy and concern for what you're going through too, and not just trying to find the diagnosis.
You're a mechanic of our body, every single thing that goes on in here. And so I really need you to hear me out, because here's what's worrying me, I think that's good care, because it's being heard, communication's good. My doctor never finishes my sentences for me, and I love that. Good care would just be listening, communicating, and actually really wanting to help the patient. You can tell they care about you. Good care is just people that care. You can tell.
I guess how important it is to take the time and to listen to people. Also, most of the doctors and nurses and all the medical people, most of them had a sense of humor because it's such a serious situation. That helped a lot to lighten things up. Just light humor to bring a smile to my face made a huge difference.
I think it's important to understand that whatever medical issue someone is dealing with, they have to deal with all of the time and not just when they're in the office. And so it's really important to support someone when you're dealing with them, so that way when they leave, it hasn't made the rest of their life harder, because they have to deal with it when they walk out the door.
I guess one of the things for that is I think, especially when it comes to kids, just the amount of time you're waiting for an appointment, especially when you don't know what the diagnosis is or you have a kid with special needs or something like that, you're in a doctor's office for, you could be there for a couple hours waiting to even see somebody. And there's really nothing you can do. And like just if there's, I don't know, with all the technology, maybe they could give you a pager going forward and like restaurants do. I think just understanding that and trying to find solutions for the families as they're waiting with the kids to help make that process a little smoother and easier.
Listen, just if they have something, just listen and don't try and finish the sentence, because you might think they have 2 words left, but they might have a paragraph left. And if you finish the wrong sentence and they're like, all right, fine, I'm not going to say anything, that doesn't mean, oh, hey, man, you got it right. Nah, that just means, oh, okay, so you're one of these that don't listen to me. Cool, I'll go back home and I'm just going to get a hold of my insurance company and just find somebody else. And that's what happens. That's how people, they'll just go doctor hopping and stuff like that until they get one person that does something that they want. I would say for me, you are going to get great feedback from your patients by just listening to them and hearing them out.
My biggest takeaways are I'm so thankful for my husband and my family that supported me through the whole process. And I feel very blessed to have such a good medical staff there at Henry Ford to take me through the 4-year journey.
My biggest takeaway from everything I've gone through after being diagnosed with CF is that no one expects this to happen. I certainly didn't. When I was tested for CF, I thought it was just another box to check off before moving onwards to whatever medical diagnosis could come next. And then it does happen and it feels life-ending, but then life doesn't end and you have to figure out how to keep going and deal with it at the same time. And that's really hard, but it is possible. You can keep living a good, fulfilled life, even with something like cystic fibrosis.
I think probably some of the biggest takeaways would be just making sure to ask questions, take lots of notes. I know the doctors would take notes too, but a lot of times we'd have certain things that maybe we talked to them about before, but they didn't have that in their notes. So we were able to bring it up and talk to them about that. I think one of the biggest things too is just being patient while you're trying to figure this out, because there's not always an answer for everything. And there can't always be an answer for everything. I know for hers, there's nothing that is all like random what caused it. So it wasn't nothing that we did, nothing that anyone else did. It was just a random thing that happened.
Don't ignore pain. That's it. Because I have a high pain tolerance, and there's a difference between being sore and being in pain. If you know something's not right, you can look at it and say, okay, that weird pressure pain, something's not right. It's like, don't try and walk through it, because the problem is your body's going to produce enough adrenaline eventually to where you're just not going to feel it. And then that's when everything gets 100 times worse. The takeaways from the experience would be just that, just don't ignore the pain, address the pain.
So my name is Audrey Shaw. I am a physician assistant as well as a certified athletic trainer. Currently, I work not only at CMU as a clinical coordinator and fixed-term faculty, but also clinically I work at My Michigan Alma and the inpatient psych unit, as well as St. Louis Correctional Facility in psychiatry. I've always wanted to go into medicine. It's kind of that cliche of growing up as a little girl and having the medical kit and listening to everybody's heart and lungs. But what inspired me to go into medicine was, again, that cliche of helping people. And I wanted to specifically help the people in the community I grew up in. I grew up seeing some of the disparities in medicine and more so the difficulty in navigating the healthcare system. And so I wanted to be that light in the community that could help navigate that. Being a medical provider, it means that I'm able to do things that other people can't do, right? We all have kind of our area of expertise that we're good at something. And so in medicine, I'm the one that can, diagnose and prescribe. But I've never looked at myself as being above someone else. I just kind of see myself as another citizen of the community. A typical day on the behavioral health unit is getting there in the morning. We have a daily team meeting where we meet with all of the therapists, the nurses, the social work, the discharge planners, and the providers. And we kind of talk about the last 24 hours of the patient's care, as well as what the discharge plans are going forward, any barriers that we have, any struggles that we're having with the patient. Following that is when we do our rounds on the unit. So we go to every patient on the unit and, talk with them about how they're doing, how they're progressing, their goals, what their life is going to look like outside of the psychiatric unit, any medication side effects, how medications are working, those types of things. We usually round on every patient, and then I go in and I do my documentation. Luckily, we have phone dictation, so I have someone remotely that documents my notes for me while I talk them. So I will go into each patient's chart, and not only do I review all of their psychiatric history during their time on the unit, but also all their medical history, because of a lot of that has a big impact on their mental health as well.
So I'm Katie Flannery. I'm the current program director at the PA school at CMU. I'm also a practicing PA. I currently work in a spine and orthopedic practice. I have my DMSC as well as my master's from CMU. My DMSC was from the College of Idaho in PA education, and then also obviously a certified physician assistant. When I was in undergrad, even high school, my grandmother was a nurse. And so we had lots of conversations about healthcare and taking care of people. And then I ended up helping take care of my grandmother, grandfather, and members of my family. And I think it just kind of went from there. Been interested in healthcare most of my childhood, kind of that caretaking piece of it, as well as the science piece of it, big science person. So that kind of inspired me. She inspired me. She was a nurse, drove herself to California and on her own back in the, I don't even know, probably 20s, 30s, somewhere in there. And so I think that was a lot of it too. I'm doing teaching, administrative responsibilities, meetings, those kind of things, typical faculty kind of stuff. But in my clinic life, which I have worked in family medicine for 10 years, full time, I did urgent care and then also orthopedics. It's about a 10-hour day. When I was in urgent care, it was 12-hour shifts. But a first hour is catching up on any messages, charting, medication refills, that kind of stuff. Then I see patients from 8 to 4:30, and then the last half hour is typically finishing up charts, charting, that kind of thing.
Yes, my name is Dr. Susanna Storing. I'm a PA by training. I'm a doctorally trained PA, and I primarily work in education, but I also continue with a patient care role, and I have a long history in healthcare administration. Medicine to me blends a number of different aspects. There's the science, there's also this problem solving aspect, but there's the relationship behind it as well. One of the things that I think really pulled me to medicine was my personal experience with providers in general. Unfortunately, I didn't have great experiences with physicians as I was growing up, but I had a great, wonderful mentor in my internal medicine specialist as I was about 16. And I'm actually a second generation PA, so I knew the role of the advanced practice provider because my dad was a PA back in the late 70s, early 80s. Every day is different. And in my current role, I'm working pediatrics. So I have a mix of patients that are being seen for attention, patients that are being seen for mental health, but I also get those acute care patients and well visits every single day. When it comes to my academic role, it's a lot of the same things. You never know what you're going to get. Everybody has their own nuances, and there's a certain amount of relationship that really needs to go into it as well.
I just relate to them, right? I get to know who they are as a person. I ask them the questions. I ask them about their families and their goals and their job and their school, and I remember the answers to those questions and come back to them, in the future, because that really shows to the patient that I'm listening, they're being heard and that I care. I care about how they're doing now and their well-being for the future. I think also it's important that, like I said, they feel as though they're being heard. So when I'm in that appointment, nothing else matters to me at that time. I give my full undivided attention to the patient because it's very easy to look at your watch or look at the clock or look away. And all of those, nonverbal cues show that patient that you're not paying attention to them. So I always try to give my full undivided attention so that way they know that I'm listening and I care about what they're saying.
Interestingly enough, now we use like AI scribing systems. We don't have to be behind our computer so much. And so not only looking them in the eye and speaking with them, but also away from my computer, as well as just talking to them about just general life things, maybe their children or spouses, or I live in Lansing, so they'll have a Michigan State sweatshirt on. We'll talk about the basketball game the other day, or maybe they work with cars and we talk about that. So I try to find something that they do on a personal level and speak about that, not just their health.
But I really feel like relationship is the big thing, because I can't get the crux of what is going on with a patient unless I know them. They have to be willing to open up to me, and I have to be able to really understand their culture, their personal values, and their expectations. And without having a good relationship, I'm not going to be able to formulate a diagnosis.
When you first start out as a new grad, you're like a fish out of water. You are now the one that everyone is looking to make the decisions, and you don't have someone, to look to and be like, hey, what should I do? So starting out in your career, it's a lot of imposter syndrome. You feel like maybe you shouldn't be here. Maybe you don't know enough. What was I thinking? But as you start practicing and you get a good mentor and you're, sharing these feelings and these concerns with them, and you're asking questions about how to manage patient care and what do I do when this lab is abnormal? What do I do when this medication fails? Your confidence grows and your knowledge base grows. And this happens very quickly. And so over the course of the past almost 7 years, I can say that I have not only grown with my medical knowledge, but also in my knowledge of the medical field in general, and then patient relations. I know a lot more when it comes to, okay, what happens in this situation? What happens when, your patient doesn't want that? And how to navigate that. So basically, in a nutshell, confidence has exponentially increased, but also the desire to continue to learn is still there as well. So every day in medicine, you're learning something new. So you're always looking something up, or maybe even changing your practice based off of evidence-based medicine.
I went straight from undergrad to PA school and graduated in my very young 20s. And so over time, as I became a wife and a mother, learning that piece of life, as well as just general day-to-day education from my patients from their life experiences, definitely has had me grow, on top of medicine changing all the time. And so you're constantly studying. No matter how long you've been in it, you learn something new every day. And so that's a big part of this occupation and or teaching as well, and staying up to date on things.
So one thing, I've been practicing for 25 years. So if I go way back, I think, well, I want to make sure that I get it right and make sure that the patient is treated well. And I still had the connection. I've always been a person who really is very much about relationships, but it was less so that way when I first started out. And now it's more to the fact of, how are you? What's going on? Really understanding the patient's heart, their needs, and then moving forward with the outcomes.
So I graduated PA school in August of 2019. And so I only had a few months under my belt before COVID-19 hit. And while I was working in psychiatry and maybe didn't see a lot of the medical side of COVID-19, I saw a lot of what happened because the mental health patients were not able to get the medications that they needed. So our unit was completely full, a 30-bed unit. And we were also housing patients not only in the ER, but on the observation units on the hospital floor as well. And so we were struggling with being overworked. We were struggling with the stress of COVID and being in the hospital. And I was a baby. I was a new grad at that time. And so that was when I really lost some of my self-care. I was putting everything that I had into work and not taking care of myself. And burnout happened. I was working 21 days in a row with 2 off. I wasn't taking time for myself or for my family. And it took one of my friends pointing that out, that, hey, like, you're not reaching out, you're not getting out of the house at all, for me to realize, okay, something needs to change. And so I scaled back on the days in a row I was working. And so I was only doing 14 days in a row instead of 21. And then I also started working out again, eating healthy. I was meal planning. And so when you're able to put time into yourself, then you're able to really fight those symptoms of burnout, and you're able to go into work with an open, clear mind and really treat your patients how they deserve to be treated.
As we were recently going through retaining our accreditation, it was a lot of extra work in nights and weekends. I also did my DMSC on the side. So I was going to school, doing accreditation, then also taking over this role as well as working clinically. So I think a lot of it was just recognizing it and then just leaning on either coworkers or even family members to help you kind of support through that.
Unfortunately, I have been severely burnt out in the past, to the point that I wanted to step away from medicine, and even to the point that it was detrimental to my mental health. Well, I think one of the misunderstandings about burnout is that there are so many system-based problems, and most problems that result in burnout, most of them actually come from an organizational level. So I think that advocacy has been a huge part of my navigating that, but also understanding, how am I going to deal with this? Do I need to take a vacation? Do I need to refill my cup? Or do I need to actually step away from this role? Unfortunately, in 2023, that was what it came to. I had to step away from a role that I absolutely loved, and it just became too much. Being a full-time provider and a full-time healthcare administrator for 3 years during COVID was excessive, and I advocated for myself. I said I needed help. I said, this is how you can improve things, and my organization failed to comply. They failed to help. And at that point, I said, you're going to have to continue without me.
That we know everything and can fix everything, especially in psychiatry. I think that while we do know a great deal, we sometimes can't always fix everybody, even as much as we want to. And I think sometimes our best efforts, people kind of brush them off and say, well, they're not doing enough for me, or they didn't do this, or they didn't do that. And, there's always more than one way to get to a desired destination in medicine. And not every provider treats people the same exact way when it comes to treatment plans. And so I feel like one of the biggest misconceptions is that we aren't doing enough, or we know everything, but we're not fixing the patient.
I think at times it's difficult because we run late, right? And so patients assume that we don't respect their time. And really, that's not the case at all. Sometimes some patients will take longer than others. Sometimes it takes longer to get documentation or results, and so you run behind, or in my instance in orthopedics, x-rays running behind, so then I'm running behind, and it kind of snowballs into this. Or your first patient's at 8, well, they're not back in the room until 8:15, and then it's 8:30 before you see them, and then you're a half hour late just to start your day. So I really think one of the big misconceptions is either A, that we as healthcare providers don't respect patients' time, because we do. And then I think a lot of that folds into, then we're working through lunch, trying to catch up a lot and doing a lot of things outside of those clinic periods of time.
But I think one of the biggest misconceptions about advanced practice providers is that we're some mid-level. When I think of mid-level, I think of mediocre. And I will say, from what I have experienced, what I have done, what I help to produce in my academic career every day, we are not mediocre. We are exceptional. PAs I'll use that as my kind of sounding board. We're trained in a medical model just the same way that physicians are. It is a lesser period of time, but we have extensive both medical training as well as clinical training, which is much more than what I would call mid-level. As a woman in medicine, even though now healthcare is primarily women, it's still very difficult to gain that respect and be able to balance all of the things that we have to do as women. But I think as an advanced practice provider too, there is this misunderstanding that PAs, nurse practitioners, are somehow lesser than in the healthcare roles, when so many times a PA or a nurse practitioner is the primary care provider for a patient. So I think that there's definitely the understanding of the role that we have to take into place. And then there's also, there's burnout that is a huge challenge.
We're supposed to be the ones that people go to find an answer. And sometimes in medicine, there is no answer. And that can be really hard for patients to understand. Why do I feel this way? Well, I can talk all day long about the neurotransmitters in your brain and the lifestyle modifications. And even when we make changes to those, you may still not feel better. And I don't have an answer to that. I don't know why that is. Also, sometimes even though we are doing everything in our power to help you, that sometimes our decisions are overridden by insurance companies or other places. We do our best to do what we believe is right for you, but we unfortunately sometimes hit roadblocks, and a lot of times it is the insurance companies. And then also thinking of the burnout. I don't think patients realize that 5 or more days a week, we're seeing 20 plus patients a day and talking about all the things that are wrong with them, all the things that they're struggling with. And then we have to go home and take care of our own family, take care of ourselves, and come back the next day and do it all over again. And I understand, that's what we signed up for. That's our job. But also, just with the cost of living getting higher, the amount of patients we're required to see, it can be really hard, especially when we're dealing with things in our personal lives as well. And so I think it's important to remember as patients that if your provider is running behind, there's probably a reason behind it. It's not because we like to run behind. It's because maybe the patient before you is going through something that needs a little bit more of our time. And I am going to be the provider that takes that time with that patient every single time and then apologize to the next, few patients for being late.
I wish patients understood the heavy responsibility it is. I mean, I think you a lot of times take those patients home with you. You question whether you're doing the right thing for them. And so it's really important to communicate with them and make sure, ask questions, talk with other providers, things like that, just to ensure you feel confident in what you're doing. I think that now with social media and the internet, everybody thinks they know the answer versus trusting the person that you're seeing. And I can understand too that there are some healthcare providers that get you in and out and don't really explain things very well. So I can see it on both sides, but I think there's a real lack of trust in medicine right now. And you see that quite a bit, or people feel entitled to do their own treatments and their own things, which is fine, but then we're responsible for that. And so that makes it difficult at times.
I think that a lot of patients don't understand how much heart there really is in medicine. Every single day, my goal is to give as much as I can and use the wisdom that I have been given to help other people. I tell people this all the time. My purpose was to help people, and I just happened to do it through medicine and now education.
Yeah. Aside from just PA school in general and maybe just life in general, my patients have taught me the most about resiliency and healing and humanity. I don't do what I do for any sort of recognition, but that time when a patient thanks you for all the effort that you've put into helping them, it means the world. Seeing patients fighting day in and day out for whether it's their mental health or their physical health, it really shows to you the resiliency in humanity, and how if we believe and we have positive thoughts, how sometimes we manifest those into actually being true. Our bodies can do amazing things. And I've seen people heal from things that they shouldn't have healed from, but they had that resiliency and that drive to fight. And it really changes the outcome compared to someone that, may not have that resiliency level and feel very negative and maybe not even have the support around them of family, of providers, of friends to help them through, a difficult time.
A lot of patients are resilient. A lot of patients will come back. A lot of patients will go through some really significant struggles, and you think you have it bad, and then you hear somebody else's story. And so kind of looking at that with compassion and trying to figure them out as a whole, not just for the one problem that they're in, but kind of look into what else is going on in their life is important.
When I think about resilience and healing and humanity, I think that what we need to do is we need to go back to our why. And we need to consider, who am I taking care of? Why am I doing this? And that will then lead us back to remembering that our patients go through terrible things all day long, whether it be childhood trauma or a diagnosis of cancer, or just need for somebody to be there and hold their hand. If I can't refocus on my patient and remember my why, then I'm not going to be much good to anybody. I literally just said this to one of my colleagues today. When it becomes less about the patient and more about gaining a career or gaining financial benefit, that's when you need to step back from medicine, because the human aspect is taken out of it.
I think the documentation side, the paperwork, administrative side of medicine takes away from our patient care. There are corporations that want you to see more and more patients in shorter amount of times so they can make more money. And I don't agree with it at all. I think a patient coming in with whatever concern they have deserves the amount of time that it takes to address that situation. These 15-minute appointments are for the birds. And also just all the documentation on top of it, right? So after every patient, we have to document our note. And our note at any time can be subpoenaed in the court of law. So we have to make sure that what we're documenting makes sense, that it protects us in a court of law. And so it's not just documenting to remember what happened, right? It's documenting to protect you in a court of law, which is not something that we should be thinking about specifically as providers, right? Especially when we should be focused on patient care. We are faced with those time constraints, right? So, a patient comes in with 4 or 5 complaints or concerns, and I can't address those all in one appointment, even though I want to. It's not how the administration wants things to go, which is unfortunate. So we're able to pick 2 or 3 concerns, and then you have to come back for another appointment, which is more money out of that patient's pocket. Technology, I think nowadays things are getting better. We used to have paper charting. Now, it's all electronic. Our electronic medical record system is integrating where we can share information with other systems, which is very helpful. And then also, even recently with AI, providers are able to just dictate with their phone. So the phone is set in the middle of the room. You have your conversation with the patient, and the AI system does your whole entire note for you. So that is freeing up a lot more time for patient care, which is really nice.
I think a lot with the AI scribing has helped tremendously. And you have templates and things that can speed things along, but there are a lot of things that we have to discuss and kind of boxes we have to check as healthcare providers, for insurance companies, for your healthcare systems, that take up a lot of time.
I think that it's a combination of the need to get things done. There's a lot of documentation that has to be done, seeing a certain number of patients, making certain outcomes, making sure that we, got all those A1Cs, that we had all our colon cancer screenings. There are so many quality measures that we have to take care of, and yet not keeping in mind that if I don't get my documentation done, I'm going to take it home with me. And if I have to take it home with me, that takes my work-life balance and flips it. And I don't get to communicate with my family. and I don't get to do the things that are important to me outside of work. And that lack of balance in general, I think, is what's going to lead to more providers and more people in healthcare in general saying, I'm done. And I think we saw that a lot with COVID too. It leads to that depersonalization. It takes away from the patient that's sitting in front of me that is maybe a wife, maybe a mother, maybe a son, or there's somebody's loved one. And if I just think about, I have 15 minutes with this patient, and then I've got 3 other patients in 3 other rooms, that's not going to give the patient that's in front of me what they need. And if I'm rushing through things and focusing more on the productivity and did I check an A1C for this patient that's living with diabetes? Or did I remember to order a mammogram for this patient? It should be more about the patient that's in front of me. And that's one of the things that I tell my students every day. The person that's in front of you is the only person that you have to care for at this time. And everything else has to be really sent out of your mind. So, there's this idea that we have to play the numbers game, and that definitely takes away from what medicine really should be. And it should be centered around a whole person.
Good care to me is treating every patient how I would treat a family member or how I would want someone to treat a family member. And so every time I walk into a patient room, like I mentioned earlier, they get my full and undivided attention. I ask them the hard questions that maybe no one else has asked them before. I treat them as though they're my mom or my dad or my siblings, because that's what I would want for my family. I fight and advocate for my patients tooth and nail until, they're able to get what I think is necessary for their care.
To me, that's just treating the whole person, not just the disease or just the one problem that they're there for. I think good patient care is looking at all of the aspects of the patient.
I'll use the term again, relationship. It's really about knowing your patient, knowing their values, knowing their expectations, knowing how to be able to talk to them. And it's about trust. Yes, we have to make sure that we decrease morbidity and mortality, but if there's not that trust between patient and provider, I don't feel like you can get there effectively.
That I probably appreciate and need you as much as you appreciate and need me. I thrive from being able to help patients and help people be better in general. And so without you, I think there would be a void in my life. Yeah, I appreciate you as patients.
I think the biggest thing is that we do care, and you do need to trust us, but that we are partners in this, and it is not just about me telling you what to do and not just about you doing what you want to do. It really needs to be something that we come together and do together.
I think the big thing is we're here for you, and I'm sorry that it doesn't always seem that way, because we do sometimes struggle with depersonalization, with a lack of empathy because of all the other things. And I think, and I've seen it so many times, that patients do see that we're humans too. But I also have had very long-standing patients, and just like I can read my patients can read me. And a lot of them, they know that, I might not be on my best game today, but we still care.
I would love to switch back to having longer appointment times. I'm fortunate enough in my career, in my job that I have, that I do get those long appointment times, but I've had jobs where they're very short. And I think that affects not only our ability to give good care, but also it affects the patient's perception of how medicine or how healthcare is ran. So I would love to see those longer patient times so we're able to get back to the patient and that patient-centered care and not worrying about documentation, running behind, seeing more and more patients just so places can make more and more money.
Healthcare needs to look at patients as people and not numbers, and start backing off on the amount. And I understand a lot of it's financial, right? Like, in order to run the hospitals and run the things, you have to have the money to do so. So somewhere in there, something's got to give between physicians and administrations and systems and insurance. Yeah.
So I think that less emphasis on the documentation, less emphasis on the computer and the EMR. And keep in mind, I'm also an EMR advocate. I have put in place 4 different EMR systems, and I love EMR. It's so much better in terms of documentation than paper charting, because I was around when we still had that. But I do think that this is improving. And with the advent of AI, I see that this could bring us back to a encounter between a patient and a provider where you're just sitting there and you're having a conversation, and I could be doing a physical exam and doing a history at the same time because I'm not here at my computer making sure that I check all the boxes.